New tonight, the CDC's vaccine advisory panel just voted 8-3 to approve a change to a childhood vaccine recommendation. This is around the MMRV vaccine, or measles, mumps, rubella, and varicella, or chickenpox.
So it comes a day after the former CDC director testified before the Senate, saying she worries HHS Secretary Kennedy is putting people's health at risk. Susan Menares was nominated by President Trump, but then he fired her after just 29 days on the job. Menares says it was because she refused to fire career scientists without cause or to pre-approve the changes to the childhood vaccine schedule.
News 4's Aimee has been following the vaccine panel meeting all day. She joins us now to break down what this means for you and your children. Aimee?
Yeah, guys, right now kids have two options for how they get the MMRV vaccine. They can get an MMR shot and then the V part as a separate shot, or they can get it all combined into one MMRV shot, so that is one less poke they have to endure. Now, the new CDC guidance just approved is that children under 4 years should get separate MMR and V vaccines, and the combined MMRV would not be recommended for kids under age 4. This change is because doctors say the combined MMRV shot brings a slightly higher risk of seizures for kids under age 4, about 8 cases in 10,000. However, if a child gets their vaccines through the Vaccines for Children program, that is for kids who otherwise couldn't afford it, they will still be able to get the combined MMRV shot covered. Now, all of this comes amid months of turmoil at the CDC, with the recently fired director warning the Senate maintaining access to vaccines is crucial to making sure kids don't get sick or die unnecessarily.
With the CDC's vaccine panel discussing possible changes to childhood vaccine guidance, the president of the American College of Physicians expressed concern at the idea of limiting access to the combined MMRV vaccine.
You are taking away the choice of parents to have informed consent and discussion with their physician on what they want to do for the health and benefit of their children.
Back in June, HHS Secretary Kennedy fired all 17 members of the previous vaccine advisory panel, who combined had more than 460 years of medical experience. Secretary Kennedy chose 12 new members for the panel, some of whom have been vocal critics of vaccines in the past. Some of those viewpoints could be heard at the meeting today.
I have seen parents who have opted to not vaccinate their children be some of the most educated people I have spoken with.
But Committee Chair Martin Kulldorff pushed back on the idea that the panel is anti-vaccine.
The members of this ACIP committee are committed to reassuring the public and restoring public confidence by removing unnecessary risk and harms whenever possible. That is a pro-vaccine agenda.
9 former CDC directors recently wrote an op-ed in the New York Times describing the new vaccine advisors as unqualified individuals who share Secretary Kennedy's dangerous and unscientific views.
I hereby invite each of the 9 former CDC directors to have a live public debate with me concerning vaccines.
The vaccine advisors meeting comes amid months of turmoil at the CDC, with the former director fired after just 29 days and 4 other top officials quitting in protest. Former director Susan Menares told the Senate she worries children will get sick or die unnecessarily if the childhood vaccine schedule is changed. An NBC News investigation found in nearly 80% of counties and jurisdictions in the U.S., vaccination rates have decreased over the past 6 years.
Now, the other vaccine in the spotlight this week is hepatitis B. The CDC is considering pushing back the recommendation for that shot from immediately after birth to a month after birth. Today, several committee members, as well as other doctors and nurses, shared extreme concern over this, saying the hepatitis B vaccine is safe and has saved millions of lives and protected babies from going on to develop lifelong liver issues. The committee is scheduled to vote on that change tomorrow. Back to you.